Veteran Suicide, the Battle After the War. My name is Jennifer Condon, and I'm a nursing student at the Indiana State University. After this video, you will be able to differentiate facts from myths regarding suicide. You will be able to state statistics related to veteran suicide. You will be able to list warning signs associated with suicide. You will be able to list risk and protective factors that may prevent suicide. You will be able to summarize the progress the VA has made toward preventing veteran suicides. You will be able to state appropriate questions to ask a veteran if you suspect they may be having thoughts of suicide. You will be able to define lethal means and state how they differ between males and females. You will be able to list the ways in which the Veterans Crisis Line can be reached. And you will be able to identify non-VA suicide prevention resources and how to contact them. At this time, please pause and test your knowledge by taking the brief quiz attached to this video. First, we're going to debunk some myths. Many people believe that only people with mental health conditions commit suicide. In fact, 54% of suicides are committed by people with no diagnosable mental health conditions. Myth: most suicides happen without warning. In fact, there are warning signs with most suicides, either physical or behavioral. It's a common myth that committing suicide is selfish and it's the easy way out, when in fact, people who commit suicide are trying to end their suffering. Many people believe that talking about suicide will cause someone to commit suicide. In actuality, talking about suicide is a means of eliminating the stigma. Myth: when someone is suicidal, there's no chance of recovering from it. Actually, suicidal ideation is often short-term and situation-specific. Here are some statistics from the Veterans Affairs National Suicide Data Report, which covers years 2005 through 2016. An average of 6,000 veterans commit suicide annually between 2005 and 2016. Actually, that number is even higher now because currently it's approximately 22 veterans a day are committing suicide. In that same time frame, between 2005 and 2016, veteran suicide rates increased by 25.9%. Veterans commit suicide at a rate that is 1.5 times higher than the general population. Lethal means, or the method of committing suicide, for male and female veterans are somewhat different. Male veterans most commonly use a firearm, but females most commonly poison themselves. Veterans between the ages of 18 and 34 are committing suicide at increasingly higher rates than before. 58.1% of veterans who commit suicide are 50 years old or older. Risk factors for suicide are attributes that increase the likelihood of suicide and include things like prior suicide attempt, mental health diagnosis, life stressors, and access to lethal means. Warning signs are behaviors that may indicate that suicide is impending. Warning signs include increased substance use, risky behaviors, anger and/or rage, social withdrawal, and getting their affairs in order. Protective factors are attributes that decrease the likelihood of suicide and include things like having coping skills, having a sense of purpose, strong connection with others, and having access to mental health services. Let's take a look at the VA suicide prevention timeline. In 2004, the VA and the Department of Defense had their first suicide prevention conference. This is an annual conference for sharing research findings, evidence-based practices, and policies as they relate to suicide prevention. In 2007, the Joshua Omvig Veteran Suicide Prevention Act was enacted. This act directed the VA to establish a program to reduce the number of veteran suicides. Also in 2007, the VA created the Suicide Prevention Coordinator position, and the Veterans Crisis Line was implemented. In 2008, the VA began a high-risk flagging on patient charts. This procedure creates a flag that pops up when you first open the patient chart so that you're aware of their special circumstances. The SAVE online suicide prevention training program was launched in 2008 as well. The program provides education about identifying veterans at risk and what to do when you do identify a high-risk veteran. Between 2009 and 2011, online chat and texting options were added to the Veterans Crisis Line, making it more available to more veterans in need. In 2015, the Clay Hunt Suicide Prevention for American Veterans Act was passed. This act directed the VA to expand suicide prevention programs by increasing access to mental health care, creating a website of resources, creating a program to repay student loan debt for psychiatrists as a means of recruiting them to VA facilities, requiring dual care with community providers, and requiring annual evaluations of VA mental health and suicide prevention programs as a means of increasing accountability. In 2016, the Recovery, Engagement, and Coordination for Health Veterans Enhanced Treatment, REACH-VET, the initiative was launched. REACH-VET is a tool that identifies veterans at risk for suicide who may benefit from outreach and enhanced care. REACH-VET is designed to be complementary to other suicide prevention tools available at the VA. And in 2018, a presidential executive order supporting our veterans during their transition from uniformed service to civilian life was issued by President Trump. This order dictates that all veterans must have access to quality mental health services and suicide prevention services, especially during the first year following their separation from the military. If you suspect that a veteran is feeling suicidal, what should you do? First of all, be very sensitive but direct and ask them, how are you coping with your current stress? Do you feel like giving up? Are you thinking about hurting yourself? Have you thought about suicide? Do you have a plan for suicide? Do you have access to lethal means? And you can always contact the Veterans Crisis Line, even as a family member of a veteran in need. If you need to contact the Veterans Crisis Line, you can contact them through the phone at 1-800-273-8255. You can chat with them online at www.veteranscrisisline.net, or you can text them at 838-255. There is also support for deaf and hearing impaired patients. If you're not near a local VA facility, you can also locate community resources. You can call the National Prevention Lifeline, Veterans Press 1, at 1-800-273-8255. The Crisis Text Line, text TALK to 741-741, or you can look at the Suicide Prevention Resource Center at www.sprc.org, or you can contact your local crisis hotline. Locally, that is in Blair County, Pennsylvania, the phone number is 1-800-540-4690. Although veteran suicide rates are on the rise, there are options available to get help. Call the Veterans Crisis Line, look for local resources, and be there. If something seems off, ask. Our veterans don't have to suffer alone.